A lot of patients also come in sometimes feeling like providers have been just blaming their HS on the fact that they're overweight, if they are overweight or obese. And I think that approaching diet and exercise from a more sort of supportive way is beneficial, and making sure that the patient knows that it's not just because they're overweight or that they're not eating well that they have HS. I think that's also a really important point to get across, so they know that there's no blaming going on.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, what are we talking about today? I feel like it's HSE.
It's HSE? Absolutely, yes. You know, one of the most incredibly devastating diseases that we see in dermatology, and so prevalent, and I feel like it's all around us all the time. Just the other day, had a meeting and someone said that they know someone who knows someone, and everybody seemed to be having it. And, you know, I see quite a bit of it. I know you do as well. And one of the biggest questions that patients have all the time, and other dermatologists as well, is do we have to go the medication route? Is there something else we can do?
That's exactly what we're going to talk about. We have an expert on to join us, Dr. Jennifer Hsiao, who's an assistant clinical professor at UCLA in their dermatology division, and she directs the HS, the Hidradenitis Suppurativa clinic, and she specializes in the management of this really challenging condition, and she takes an integrative approach. I can't think of anyone better. Thank you for joining the podcast.
Thank you both so much for having me. I think this is such an important topic, and I can't wait to talk more about it with you both.
Fantastic. Let's just dive into it. I wanted to ask you first, how did you get interested in HS? You know, these are really difficult cases, as Raja said before. Wonderful people, but very challenging disease, and not a lot of great therapies out there. So it's not one of those things you finish residency and say, you know what, I'm going to do that. How did you end up doing HS?
Yeah, that's a great question. For me, it actually started in medical school. One of my mentors was interested in HS and PG. So we actually saw a cohort of patients who had both HS and PG, so two pyoderma gangrenosum, so two devastating diseases together. And I just remembered feeling just this overwhelming sense of like, I wish there was more we could do. And then during residency, you know, I basically, every time I had a patient with HS, I wanted to be able to follow them longitudinally to see how they were doing. And then as an attending, I just started to ask them to follow up with me, started to see more HS patients. I worked with Dr. Bennett, who's a wonderful surgeon in terms of surgical management of HS. And really for me, I think just allowing patients to have a space where they can feel like their needs will be addressed. They'll be able to hear about, you know, up-to-date information about HS and feel like even if we try some therapies and it doesn't work, there's other things we can try. It's been very fulfilling for me and really just excited to see all of the research and progress that's been going on in this field.
Absolutely. And I think, Raja, you can share your feelings as well, but I think the keyword here is fulfillment. I mean, I got to say, HS sort of found me. And I know that there's this kind of stigma among doctors in general that because you cannot offer a cure, you feel frustrated and you're kind of afraid of it. And you're saying to yourself, what am I going to do? And so you kind of tend to not want to see these cases because you feel you can't help. But I got to say, doing this day in, day out, I couldn't see anything farther from the truth because you are making a difference for these patients. I feel they're so grateful and I have such a fulfillment out of this. I think you hit it right on the head there. So Raja, how did you end up taking care? I know you take care of a lot of patients with HS. So how did you end up with that? What are your feelings about that stereotype that's out there?
You know, I think HS patients are sine qua non the ultimate patient for an integrative approach. because we need so many different factors. There's so many metabolic issues that come up. And so I'm really excited that we're talking about this, because I think that's a condition that's frequently misdiagnosed or just not diagnosed for years and years. I think we're starting to become better as a community about diagnosing this. I know dermatologists are aware, but outside of that, and on that note, Jenny, do you mind just going over what are the key salient features that really trigger your thoughts that this is HS? Can you talk about the overlap with, say, pyoderma gangrenosum, and how are they connected to other inflammatory like neutrophilic dermatoses that are out there?
HS typically is a clinical diagnosis, right? So providers really don't have to do a biopsy, or culture anything to make the diagnosis of HS. And really typically happens, to have like boils. A lot of times patients will say, I have recurrent boils that just keep coming, or recurrent abscesses that occur in like the sort of intertriginous fold areas, like the armpits, under the breasts, the groin folds, the buttock area. Although importantly, I think it is important to note that a lot of times HS can still also present in atypical areas as well. For example, the back of the neck or on the trunk, sometimes even on the face. So typically intertriginous areas, but doesn't have to be. And then I think it's the chronicity that really sets it apart from someone who just, for example, has an isolated boil or furuncle. In addition, with untreated HS, we really start to see sort of the classic tunnels and sinus tracts that you can get, sometimes so interconnected that if you just push down on one end, all the way on the other side of the sinus tract, maybe like all the way on the other side of the armpit, you can see drainage come out because everything's so connected. So those are sort of the clinical features that I look for in terms of making the diagnosis of HS. Although it is also important to rule out potential HS mimickers, there are atypical infections that can mimic HS. For example, even atypical tuberculosis, for example, can sometimes present with sinus tracts. But all in all, it is a clinical diagnosis that I think, especially if, providers and physicians have seen it in residency and training, they should be able to spot it. And I think a lot of the work that needs to be done is actually helping our frontline providers like internal medicine doctors, pediatricians, OB-GYNs, urgent care, emergency physician doctors also be able to identify this condition early and refer to dermatology.
So let's dive into some of the topics we really wanted to cover today, because HS is such a broad topic and there's so much to talk about. But today we really wanted to focus on the use of alternative medications in this population. So a very fair question is to ask, how much do the patients seek these kind of treatments?
In my experience, patients are very interested in exploring treatments that are outside of, quote unquote, conventional medication. And we had done a study that looked at patients who were in Facebook survey groups and also in sort of HS specialty clinics, asking them about their complementary and alternative medication use. We had over 300 respondents to this survey, and over 80% said that they used some form of complementary and alternative medicine for HS. Only a subset of those actually reported that they used it to their healthcare provider. And I think that this just lets us know that if you're seeing an HS patient in clinic, there's a very good chance that they're not just taking, whatever medication had been prescribed by their most recent provider. They're also seeking and using other treatments that they've heard about or read about in attempts to make their disease better. And honestly, I think a large part of this is probably also due to the fact that they've probably tried conventional treatments and found that a lot of times it doesn't necessarily provide the relief or the benefit they're looking for. So they want to try other outside treatments as well. And so I think there's a frustration that can lead them to want to try new things. And they're also looking to see if the provider or physician that they're talking to is open to discussing that.
Yeah, you bring up an excellent point, because I do think there's a bit of a test there. And that's true, I think, outside of HS. And we talk about it a lot, that patients come in and they ask you a question about alternative medicine. And then by your body language and the way you respond to that question, I know a lot of physicians really get this kind of internal reaction where it's like, I don't want to talk about it. Nobody taught me about it. I don't know. Leave me alone. There's that kind of panic that ensues, and the patients feel that, and there's a lost opportunity there, right? There's a lost opportunity for bonding there, for you to make that connection with the patient that can be, career long connection. So I think you're bringing up a good point. And the other thing I wanted to ask you, going back to your study, what have people actually been trying?
Yeah, so, there's a lot of different CAM therapies actually for HS that a lot of people have tried, including different supplements, for example, like oral zinc or vitamin D or C, topicals as well, like topical CBD. Some people take oral CBD. Baths, people use Epsom, like salt baths. There's just a myriad of products that were listed, curcumin, for example. And then in terms of treatments that they do that are sort of like CAM methods, dietary modification is a big one. In addition, some people have tried even yoga or Pilates, acupuncture. And I actually have patients who have done acupuncture and reported that they felt like it helped with their HS sort of achiness or pain. So there's a lot of different methods and products that were elicited in the survey, some of which I definitely directly hear from my patients as well.
Yes, I agree. And I know I certainly hear that a lot in my clinic and my practice patients. I actually try to ask them and elicit this from them to say, what have you tried? And they kind of list through in my part of my intake, they will say, I went to this doctor and I got this medication, and I went to this doctor and they did this kind of surgery, and I had IND and all this stuff, incision and drainage. And I say, what else? And I keep saying, what else? And invariably they'll come up with some of the other stuff, the other stuff, quote unquote, that they have used. And I think, again, that's a great opportunity for bonding. I wanted to ask you, more than just bonding, what kind of strategies do you use that you mentioned that you think may have a role in the management?
Yeah, I think you make a great point about first the importance of just listening to the patient, and especially if they tell you that there's something that they're doing that's helping. I think validating that and letting them know that you're really happy that they've tried something and it, actually works and is beneficial. And just like Raja had said, there's a lot about HS that makes it really well suited for an integrative approach. It's because we don't know the exact pathophysiology behind it. There's so many things that could be contributing, including metabolic factors, et cetera, that could benefit from discussions about diet, et cetera. So I typically will definitely talk with my patients, especially those that want to try something that's, they have perhaps mild disease and they're asking about supplements. I always talk to my patients about oral zinc. And one reason for that is just because there have been pilot studies that have shown that for patients with sort of milder disease, they can have improvement of their HS with fewer cutaneous lesions and disappearance of lesions that they already had if they take oral zinc. And so I typically will have them take 90 to 100 milligrams a day, tell them to take it with food because it can cause some stomach upset. And I think patients have been really receptive to that as just a way where they think, well, it's not going to hurt, right? And it's not something I've tried before. And it seems like we're open to trying also sort of more quote unquote natural treatments as well that could be beneficial. And then I feel like that's a great adjunct therapy that can be paired with a lot of different medications that you may want to try.
No, I love that approach. And when you're looking at zinc, how long do you treat them for? And do you ever add in copper just so that they don't become copper deficient long term if you go that route?
That's a great question. I absolutely do. We typically want to supplement zinc with a zinc to copper ratio of about 10 to 1, just because too much zinc can actually compete with sort of the small intestine absorption of copper. And copper deficiency is definitely not something we want our patients to have. So I tell them to take it with trace copper, and I'll typically just have my patients take it as a supplement. And a younger, like adolescent kid to like even a woman who's pregnant, I feel like zinc is just one of those medications or treatments that can be given without really fear of harming the patient. And I believe that there is an anti-inflammatory component that's helpful. So I haven't really stopped zinc on patients. Sometimes they can't tolerate it because of, GI side effects, but part of it too is you want to make sure that you're, giving them a zinc formulation that's better absorbed. So zinc gluconate or zinc picolinate are better absorbed than zinc sulfate. So that's what I'll counsel my patients as well.
That's great, Jennifer, because I think, people are always looking for what can I use besides antibiotics? And, this is one of those diseases where chronic antibiotics is frequently used. And so just to change gears, but not too much here, what are your thoughts around the microbiome and use of probiotics? Where are we with the research in that area right now? And do you incorporate any probiotics when you talk about treatment regimens?
That's such a great question. So I have not seen any studies in the literature yet on probiotics in HS, although I bet they're like on the horizon. There's a ton of literature sort of on the, cutaneous microbiome and HS. And then I believe there was one study that looked at sort of the gut microbiome in HS, showing that basically patients with HS have reduced diversity of, their gut flora compared to a healthy individual. I think it's still sort of early in terms of really thinking about how to improve or how much the microbiome, gut or skin affects HS and how we would address that. For sure, I believe the microbiome is involved. I think that it's just, I don't recommend a probiotic right now just because I think it's early still, but I'd love to hear if the two of you do anything with probiotics in HS. I think this is a study that's just waiting to be done.
Yeah, I mean, in terms of diet, I know that I try to test as much as I can, and it's not always feasible, but for anti-Saccharomyces cerevisiae antibodies, there's a good study that was done not too long ago. And what I like about this, that if it's positive, there's actually something tangible to do about it. And that's using some diet that basically eliminates sort of brewer's yeast out of that. So if somebody's positive, I'll talk to the patient and say, look, this may be an issue for you and it has been associated in the past. And why don't you try this for a few weeks and see if that makes any difference for you? And we talk about, trying to reduce the amount of all these bakery products, bread and cakes, the good stuff, beer, wine, fermented cheese, those things that are in the way. But I always, when I talk about food, I don't say this is what you can't. I say, here's the things that you want to reduce, and here is a whole slew of things that you actually can eat. And you can eat a ton of vegetables and fresh fruits and cereals, and all these really are safe for you. Eggs, you can still drink your coffee and tea. And so I try to really engage them like that, because I think a lot of times people hear, oh, I can't do this, I can't do this, I can't do this. And it leads to two things in my mind. One, they just don't do it. Or two, they try it for 2 days in a crazy way that's really not practical. And then they kind of fall flat on their face and fail. And then it makes things even worse. So, that's one thing that I feel like has decent evidence for that. And I can work with the patient on improving.
Absolutely. I agree with you on the point about brewer's yeast. There is literature showing that it can be helpful to avoid, but brewer's yeast is actually in a lot, just like you said, a lot of good things. So I love your approach about still talking about here are things you can still do. And,
Yeah. And I'm not going to, I tell my patients, listen, it's not like you can't have pizza now for the rest of your life. That's not practical, right? You can't not have bread. But if you eat pizza, 5 times a week and you take it down with 2 pints of beer, then maybe rethink that, right? And by the way, it's probably healthy for you to begin with. So, healthy HS diet is actually healthy diet, period, for most part, I think.
Yeah, I completely agree. I think just like you're saying, approaching it from a more sort of positive attitude, just because a lot of patients also too, I think, come in sometimes feeling like providers have been just blaming their HS on the fact that they're overweight, if they are overweight or obese. And I think that approaching diet and exercise from a more sort of supportive attitude or supportive way is beneficial, and making sure that the patient knows that it's not just because they're overweight or that they're not eating well that they have HS. I think that's also a really important point to get across, so they know that there's no blaming going on.
I didn't have too much to add to the probiotic conversation, except to say that I'm hoping there'll be more studies. What I've started doing is, acne and HS are not the same disease. They really are not, although there's a lot of coincident occurrence between the two. So I will use some of the probiotics that have been studied for acne and I'll incorporate it into HS treatment programs, especially if I do end up having to use antibiotics, just to mitigate the risk of any sort of vulvar candidiasis, especially in women. But I'm hoping there'll be an actual study with one of these probiotic regimens. Let's see what happens.
Let's see what happens. I think you bring up, though, a good segue into combining these therapies. Some of the ways you can use alternative medicine is in synergy with some of the more conventional medications that we use. Jenny, any tips on that?
Yeah, so with conventional treatment, it's also so multimodal, outside of an integrative approach, sort of East-West medicine together, for example. There's hormonal treatments for HS and so many biologic agents that are coming out, oral retinoids, oral antibiotics. So there's so many ways to sort of approach someone's HS and thinking about what might be driving their HS and thinking about the appropriate medication to target for that particular patient, what's driving their HS. So I think in terms of an integrative approach, lifestyle modifications are key to discuss with HS patients. And we've sort of touched upon, the diet, et cetera. And then other supplements, like if they are vitamin D deficient, to consider vitamin D, think about zinc. Topically, using a wash and a topical can be helpful too. And I have patients who have reported that there are certain topicals that they find helpful. For example, like a topical CBD, some patients have reported have helped decrease inflammation and decreased pain. And other things to consider would be to look at the patient holistically, think about smoking cessation, what kind of clothing are they wearing. HS, I believe, is really worsened by friction. And so thinking about what the patient can wear that won't cause daily irritation of their skin lesions is also important, and having a discussion about that and how to choose better clothing, better fabric. And then really also thinking about colleagues that you can get involved in the care of these patients, whether it's, we have at UCLA an East-West Medicine Center, and they do things like acupuncture, biofeedback, et cetera, which I think has been really helpful for some of my HS patients. I don't know if either of you have experience with acupuncture and HS that you can speak to, but it's helped some of my patients.
I don't have particular experience with that. I mean, every now and then I'll refer someone to a traditional Chinese medicine practitioner, and they may incorporate that or not, but I don't have direct evidence on that. But you do bring up an interesting point talking about lifestyle medication. And I think in HS specifically, especially in people who are overweight, we say a lot diet and exercise, diet and exercise. Nobody really pays attention to the exercise part. And I want to ask you if you have some solutions for this, because I have not been able to come up with really great solutions. How does a 300-pound person who has draining tunnels exercise? They're in pain, they keep draining. You talk about friction. Well, most exercise involves some kind of friction. It seems to me like we're making a suggestion. At least I want to make that suggestion, but I'm afraid to make it because it's going to make things worse. And the last thing you want is to send a patient on a journey that they're going to fail like 2 days into. So I wonder if you guys have any solutions for that.
That's a really good point. And I do feel like patients will actually come and just outright tell me that they can't exercise because it's too painful or because it definitely triggers their HS. And so one thing to consider before going into the exercise talk too is to think about adjunct, perhaps bariatric surgery. If somebody has a BMI of 40 or higher, or they have a BMI of 35 or greater, but they have some sort of obesity related comorbidity, whether it's heart disease or diabetes, et cetera, and they've tried on their own to lose weight, and they have HS, for example, in their abdominal fold and their groin, it's just painful. One thing to consider would be bariatric surgery referral. And I actually have a handful of patients who have gotten bariatric surgery, and where before they were on a lot of medications to try to help their abdominal HS, after the bariatric surgery, they actually got significantly better to where like systemic medications were no longer needed. And I think that that's something that we should all have in the back of our minds. Again, it needs to be discussed in a sensitive way and definitely research done to see if they've already had the discussion in the past, et cetera. But that could be one thing where we could plan for something like that, get the draining under better control, plan to have the bariatric surgery, work on nutrition, and then get them to a point where they would feel more comfortable exercising.
Yes, and one of the strategies I've been trying to offer patients, although it's not always practical, is maybe try to exercise in a pool. So there's less weight, there's less friction, but some patients just really can't tolerate it. It stings, they feel uncomfortable. But that's a solution sometimes that worked for me, because I do think that the endorphins you get with exercise are so important in general, right? Because there's so much psychological comorbidity that goes with HS that I feel like that's an added value right there. Hey, Jenny, always a pleasure talking to you. You are such an expert. I feel every time we talk, I'm so lucky. Every single time. I want to thank you for shedding light on this issue of alternative therapies for these really great patients that we have in our clinic every day. And I want to thank you for your time and your expertise.
Thank you both so much for having me. It was so nice to have this conversation with you, and I hope you guys have a great rest of your evening.
Same to you, Jenny.
Thank you for tuning in to today's episode with Dr. Raja and Dr. Hadar. This podcast is brought to you by Learn Skin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs, or subscribe to the podcast today and never miss an episode. Hey, have a great day and stay curious.